This video is on a serious note that why are students failing in the West Bengal University of Health Sciences exam. And if you are from any other board, a medical student, then you should watch the last part of the video where I have told that how should you make the answer to impress your examiners to get distinction and to get easily pass marks. So at first, let's see the situation in WBUHS. There has been record number of fails. You can pause the video and see in which college how many have failed, how many have passed, and how many have got honors or distinction. Approximately in anatomy, 28% have failed, physiology, 16% have failed, and biochemistry, 20%, 20 to 25% have failed. I have taken the total number of MBBS students, that is the MBBS seats, 5,700, because if anyone has failed in their internal assessment exam, he or she gets direct supplementary exam. So I have to consider that also in the denominator. Now, reason why this kind of result has happened. Number one, the paper was difficult. Number two, the main factor, sometimes the paper comes difficult, but this time the evaluation was different because this time the evaluation was on computer screen, means your answer scripts were scanned and they were uploaded into the system, and faculties have to sit in the computer screen, spend 10 seconds per page in the questions, and if their head rotates here and there, then only the system logs out. So this was a very complicated system, and this was implemented for the first time. From where I have got the insider information, because our MD exam also happens in the same way. The answer scripts are being scanned and being uploaded into the system, and faculties check that. So our faculties have checked the exam papers of the MD examination, and they have told us that this is the system. So your if your handwriting is poor, then you are bound to get less number of marks. See, I have changed my handwriting twice in this 1 year. Previously, if you see my older videos also, I used to write in cursive handwriting. Because this kind of checking is happening, so I had converted my cursive handwriting into spaced handwriting, but it was slanting. Later, I changed from slanting to vertically oriented handwriting just to make the answers and the words clear so that examiners have less difficulty in checking my answer sheet. So, your handwriting is the most important thing in a written exam. And this time the students number have increased because the MBBS seat has exponentially increased, but the number of faculties who are checking the exam paper has not increased. So there was a time crunch, and so they couldn't check with great amount of time and patience. What to do now? If you have failed in any exam, any paper, then you have to apply for review, because in review marks increase. इतना खराब जब result हुआ है, so it is bound to increase. Some will get pass marks after review only. If you see, I had given review in my third year and in my final year. I was full to not give in my second year. So in ENT I lost honors due to 1 marks, and if I got the honors in ENT, then I would have got grand honors, that is honors in all the three subjects. So after giving review, my 2 marks increased from 74, I got 76, and I got grand honors. In final year, I didn't get expected marks. So I gave for review 4 papers, out of which in medicine paper 2, my 3 marks reduced, but in other papers, my 19 marks increased. Ultimately, there was a jump in 16 marks, and just for 1 marks, I stood second in my college. So if I had not given review for the medicine paper 2, then probably I would have got the highest in the final year. Coming to how to pass easily and how to get honors or distinction, this is for all the medical students who are watching this video, irrespective of the board. Your handwriting should be legible, as I have said. Structure your answer. I am giving you an example. Write a short note on scabies. This question comes a lot in the medicine from dermatology. So I will give a description in one line. Scabies is a contagious infectious disease caused by mite and associated with severe pruritus. Then I have given a headline with black color. Use black color pen for headlines. Positive organism Sarcoptes scabi var hominis. Epidemiology, again with black color I have highlighted. Male equals to females, winter season, overcrowding, poor oral hygiene associated with scabies. In point wise, you have to write the answer so that examiner can read your points. Clinical features: pruritus more at night, papules along the circle of Hebra. Now here I have done a schematic diagram, not an original diagram. You have to do schematic diagram of circle of Hebra and burrows in the interdigital folds. Diagnosis is clinical. By dermoscopy you can see the burrows, the subcorneal burrows, and in microscopy you can see the mites. You can draw an image of the mite also. So what you can understand: highlight the headlines with black color, use a different color pen, that is blue color, because it is less highlighted. For the main text, arrange them in pointwise sequence or flowcharts, add more and more diagrams. Handwriting should be legible and it should be neat and clean presentation in your paper. Treatment: you give permethrin 5%. We have to also explain that how it is to be applied, that is from neck to toe. Keep it for 12 hours at night and wash it off next day. Contacts also I advise the same, and in next week you have to apply it again. Other topical therapies are Linden crotamitone. In systemic, you can give ivermectin 12 mg. So you have to include more and more schematic diagrams. Like if a question on femoral triangle comes, the boundaries of femoral triangle, then you have to make a schematic diagram of the femoral triangle also. Use flowcharts. Like in vomiting, there is increased salivary gland fluids, deep breath to avoid aspiration, GI retroperistalsis, decreased intrathoracic pressure, retching, and vomiting. And then there is sympathetic nervous system response, increase in heart rate, sweating. Right answer to the point, as I have said, that use multicolor. Like for black, give the headings, blue for the main text, and you can underline the important points in the main text also to highlight the importance of that point, and examiner will easily catch in that 10 seconds that he gets to view an answer sheet, that what are the important points you have highlighted, and you will get a very decent marks. Because I have also got 6 honors or distinctions, and I have missed 3 honors or distinctions for just 1 mark. So I know how should be the representation skills, and if you follow this you can easily pass any exam if you have that content right, and you can also get distinction or honors. So share this video with your friends and subscribe to my channel, because if this video performs well, then I will put in more contents on for prof exams, or else I will stick to the NEET PG preparation only. And also do join my Telegram and WhatsApp channel. The link is given in the pinned comment section. You can join it for daily medical updates, important diagrams, custom modules. You can join my channel. It's free for all. And now you can see a video on what are the books you should read in first year MBBS and final year MBBS. So watch the video now. And in the end I will tell that failing any exam doesn't means the end. You have to give your best. You see the review results and give your best in the supplementary exam if anyone of you is watching this video.